Hi and welcome. I'm trying to learn medicine. Today, cluster headache. And after we've done that, we're gonna do standing yoga. And if you participate in the standing yoga, then it's better here on this. And we're talking about internal anatomy, probably a bit, a disease, and this is no medical advice. We're just learning about it. Cluster headache. A severe headache which tends to reoccur nightly for several weeks or months and then disappears for years. Okay, a severe headache, so strong headache, and it is usually in the night over weeks and months and then disappears. Its name derives from the habit of appearing in clusters. Cluster headaches are 4 times more common in men than in women. I don't really understand what I mean with cluster headaches, but maybe you will. Okay, they are 4 times more common by men than in women. The headache, which usually begins 2 or 3 hours after falling asleep, starts as an intense pain behind one eye, which wakens the patient. I think it's interesting that it happens after the person has fallen to sleep. Maybe you're going to tell something a bit, but I think that's something very interesting. The headache, which usually begins 2 or 3 hours after falling asleep, starts as an intense pain behind one eye, which wakes the patient. Okay, the person feels after having fallen asleep in the night, 2 or 3 hours into the night, a pain behind the eye. The pain is continuous rather than throbbing, as migraine. Okay, migraine has a throbbing pain. Whatever that means. It's like, I don't know what it means. The pain is continuous rather than throbbing. So a continuous steady pain, to understand on that. The eye fills with tears, the nose gets blocked and on the affected side and then runs. It would be interesting if it is just on the affected side. That would be interesting, especially for the nose. Okay, pain behind the eye 2-3 hours after having fallen asleep, and then tearing of the one eye and also of the nose, blocking and then running of the nose. The cheek may swell too, and also swelling of the cheek. The symptoms last 1 or 2 hours. Continuous pain to 1 or 2 hours. Unlike migraine, it is rather for a cluster headache to produce nausea and vomiting. I don't know what's the difference between nausea. It is. I said it previously. I don't know what it is. It is. It is rare for a cluster headache to produce nausea and vomiting. So, the symptoms last for 1 or 2 hours. Unlike migraine, it is rare for a cluster headache to produce nausea and vomiting. Again, I want to stress at this point again, that book is from the 80s. Maybe there was, in the meantime, some science done. They are saying here that migraine has more likely nausea and vomiting. And this cluster headache, not so much. Bouts of cluster headache may be brought on by stress or alcohol. Why does it happen not 2 or 3 hours into the night? I think that's the most interesting part. They are thought to be caused by a minor temporary disturbance of circulation in the brain. Okay, we're saying that maybe stress or alcohol can make it more likely to happen, and that there is a minor temporary disturbance of circulation in the brain. Why does it cause pain? If there's a temporary circulation problem. If the symptoms are reported to you, If the symptoms are reported to your doctor, he or she is likely to prescribe a painkiller with added ergot, which helps to restore the normal circulation. Taken nightly before going to bed, this may prevent an attack occurring. Why? But okay. Does the medicament have an influence on this temporary disturbance of circulation in the brain? Okay, now we're here for more for clinical thing. Okay, there can be prescribed a painkiller, and that can be taken, and that before going to bed can maybe prevent the attacks. Okay, that was cluster headache. If you were here for medicine, you can go directly. And again, this was no medical advice. We just read what was there. If you were here for medicine, you can go directly to the next part of medicine. We will do now the standing yoga. If you stay and participate in the standing yoga, then it's very honest. You have your feet staying together. Breathe in and feet arms up into it. Hier geht's weiter. Breathe out the arms down. Breathe out the arms down. In the arms up. Out the arms down. In the arms up. Out open to the side. In the arms up. Out open to the other side. In and up. Making a space between the feet and opening to one side. In and up. And out and sink halfway down. In and up. And out open to one side. In and up. And out lean onto the knees. We're doing standing cat and cow. Breathe in. And out. Make a head of the back of the cat. Again in. And out the belly of the back of the cow. And out. The head of the back. In. And out. In. And out, come up on back up, make it a double backwards, shoulder. Again the arms up. Out open to the side. In and up. And out, bring them over the sides, down and come down into the chair. You can come halfway up. High up. And out and we're coming up. Breathe in and reach high. Out up to the side. In and up. And out over the sides, down into the chair. Breathe in, come halfway up. High up. And out and we're coming up. And bring the arms back without. So shoulder blades together. Breathe in the arms up. And out again, down. Draw the shoulder blades together. In and up. Close the feet and also the hands and lean back. Again in. Out and lean again back. In and up. And out over to one side. In and a little. Out over to the other side. In and a little. Up across the arms and turn the fingers, reach high. Breathe in. And breathe out, reach in front, out of the back. Again, in and up. Intertwine the other way around, breathe in, reach high. Breathe out, reach in front, out of the back. In and up. And out, come up onto tiptoes. Breathe again in, reach high. And out and sink down into the chair. On tiptoes. In and up. And out and down. In and up. And out. Feet together, heels together, arms over sides down, we are down. And breathe again in. Bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Breathe in and change. And out and stretch the left leg. In and change. Out, stretch the right leg. In, into the middle, and just out and down. Breathe in, lift the right hand up to the sky. Breathe out with the left knee, look over the right shoulder to the right hand. In and the arm down, both legs straight. Out. Breathe in, lift the left hand up to the sky. Breathe out with the right knee, look over the left shoulder to the left hand. In and the arm down, in and down, breathe out. Now the pelican, make a hand with space between the feet, shift the weight to the heels, and breathe in and go down. And breathe out, come up. In and down. And out and up. The last time in and down. And out and up. Take hold on the elbows, chin bushes, counterweight, and gently rock from side to side. Bring the hands down, the feet together. Even come halfway up with a straight back and do not be half lift. Breathe out, come down. Even come halfway up, straight back. And out and down. And now breathe in. The updiving swan, hands over sides up. Hands together and down. Now have the feet pointing to the outside and inner limb space between the heels. Breathe in, lift the arms up. Then breathe out and sink down and place your elbows against the insides of the knees. Now breathe in, straighten up. And out and come with the belly up. Breathe again in. and out and down. And breathe in and straighten up. Now you can go again back up, or you breathe in and come up. One straight line. Hands down. Breathe in, wherever you are, arms up. And out, and we're coming back into the garden pose, even if you were back up. Breathe again in, and out, shoes up, back. And again down. Again in and up. And out and down, and one more round. Breathe in, straighten up. Out, shoes. Arms down. Again up. Out and down. And for last time, breathe in, straighten up. And out we all coming up in one straight line. And hands down. On the sun board, legs wide apart. Breathe in. Lift the arms up. And breathe out, sink down. Now come one foot onto the toes. The other one. Now breathe in and press something imaginary heavy up. And out and down. And in and up. One more time, breathe in and up. Down. Breathe in and up. Move your hands down and ankles. Now have a feet standing. Try to put wide apart, stretch your knees, intertwine your fingers behind the neck, bring them over to one side, breathe in and up. And out, bring the head over to one side. Chin down to the clavicle. Breathing in. And out, pull the arm and the shoulder down. Lift the gaze. Bring it back into the middle and out. The other side. Bring the hand over to the other side, one side, breathe in. Out, chin down to the clavicle. Put your arm in the shoulder. In, lift the gaze and the hand back into the middle. Now have the legs standing around shoulder wide apart, breathing in, coming up. And out and sinking down. And now come with the leg up. And go back up again. Also again. And again. Breathe in, lift the arms up. Out, sink down. Elbows straight instead of the legs. And come with the leg up. Come back to the You can do it again, or you do the diver, but the diver can go onto the back. Legs wide apart, arms up to the side, breathe in. Out, lean in front, this can go onto the back. Make a round back. Round back. And again, arms up to the side, this can go onto the back. Forward, straight back. Round back. And come up with the crown of the head first up. One more time. In front, this can go onto the back, straight back. Round back. Come with the crown of the head first up. And down with your arms. And we're ending. Feet are standing together, breathe in with the arms up. And out, lean back, long arms. Sky hugger. Breathe in into the middle. And out and back. Into the middle. And out and down, we're ending. The feet swings, breathe in with the arms up. Throw the arms down. In the arms up. Out and down. Now the cactus collecting its stings in the evening, breathe in with the arms up. Bring the hands to touch. Lower the hands slowly down to heart center. That was standing yoga. I thank you very much and until next time.